I'm the Capitol Nurse Practitioner, and I serve the Texas legislature and anybody else that's in the Capitol, the Governor's Office, Secretary of State. And then I also serve the employees that work for the various legislative support agencies. I have a population of about 3,000 people that I serve year-round. A friend of mine challenged me to try to join Mensa, and I thought, well, that'll be a hoot. We'll give that a try. Unfortunately, my friend didn't get in, but I did. So I came home and I told my wife that I've got a genius level IQ, and she said, well, why don't you do something with it? And so she really started pushing hard about going to college and getting a degree and using that gray matter for something besides having fun. I'd been working as an emergency medical technician out at Lago Vista as a first responder, and I enjoyed the EMT work so much that I got a part-time job working for a private ambulance company here in Austin. But whenever we brought a patient into Brackenridge emergency room, if we didn't have another call to go on, nurses there would let us hang around and help out. We could do vital signs, put bandages and dressings, splinting, casting. And frankly, at that time, I thought nurses fluffed pillows and empty bedpans. I really didn't know what nurses did. But the more I paid attention to what the nurses in the emergency room were doing, the more I decided that this was the career for me. So I enrolled in UT's School of Nursing, and I just love nursing. I think it's a great profession. I'd like to see more men go into nursing. We're still only about 7% of the profession, and I think it's a great career for both sexes. Well, there is a tradition, it's called the Physician of the Day program. During legislative sessions since 1971, volunteer physicians from the Texas Academy of Family Physicians would volunteer to work down here for one day. They needed a nurse to provide continuity of care. Since you had a different doctor every day, you wanted somebody that was here all the time to coordinate all that care. And so the Department of Human Services always provided the nurse. There was only a nurse here for the 5 months of session every odd year. The rest of the time there wasn't any medical care provider here. I got the assignment, and that was in November of '92. There was a special session on school finance. And then I did the regular session from January through May of '93. The folks here in the legislature decided they wanted me to stick around full-time. So I was first full-time Capitol nurse. But I do, I'll get concerned during flu season, especially during session. People won't stay away from work when they're sick during session. They take their jobs so seriously here that they'll come in with 102, 103 fever, coughing their head off, and so that concerns me because they're so dedicated. They need to go home and get better and not expose other people to their germs. So I have to do a lot of patient education about making sure they get what they need so they can get better and function. Everybody knows that I'm a nurse practitioner, but it's similar to being a doc in a small town in that I know, after being here almost 20 years, I know most of the folks that work here, a lot of their family. I know their medical histories and their idiosyncrasies, so this is my community. That's why I call it my capital. I don't know of anybody's feathers that I've ruffled. I've managed to stay on everybody's good side over the past 20 years. So made some pretty good friends. I love my job. A lot of my colleagues out in the real world ask when I'm going to retire. I'm eligible to retire right now, but I tell them not to hold their breath because I'm having too much fun. I enjoy my work here. I'll probably stay here until they drag me off kicking and screaming one day.